Now, more than 150 children under the age of 5 have died in South African public health facilities over the past year. Most of these deaths were linked to moderate or severe acute malnutrition as an underlying cause. The majority of the cases were reported in Limpopo, Gauteng and KwaZulu-Natal. Joining us is Dr. Chantell Witten, who's child health advocate and director of the Health Systems Strengthening at the Lebantwana. Dr. Witten, thank you so much for your time this evening. Shocking figures indeed. Only just 150 children dead in a space of a year. Are these fatalities things that could have been avoided?
Good evening, Marsa. Yes, absolutely. We know that children die because they are not getting adequate nutrition, and this is directly related to what children are being fed, how much children are being fed, and what is the quality of the food that children are receiving. And this is suboptimal, and this is why children land up in hospital.
So what kind of food are children being fed that isn't optimal?
We have very low breastfeeding rates in South Africa, and the peak age for children that are dying are children under the age of 18 months. And this relates directly to breastfeeding. So South Africa has very low breastfeeding rates. And then the quality of food that we are giving our children during the complementary feeding age. This means from 6 months, we are feeding other foods. And unfortunately, households are so stretched by the high cost of food that the quality of the food that we are feeding our young children is not enough to maintain good health and nutrition.
And we'll chat a little bit about also just the high cost of living that families find themselves having to stretch their income as well. But do we know, Dr. Witten, why we have a low breastfeeding rate?
Yes, we've done a number of assessments. Internationally, South Africa has been assessed, and we've looked at reasons why women are not able to really breastfeed. It's not always just personal choice. Our mothers are not supported, firstly, both in the hospital. Many of our private hospitals are promoting formula feeds. And even though government is promoting breastfeeding, we see that our society is not a breastfeeding friendly environment. Mothers often do not have spaces. They are working. They do not have space to express their breast milk. They do not have space to bring their children onto their work premises because we are not a child-friendly environment. And then we have something in South Africa which is very well documented, is the aggressive marketing of infant formula. And that has infiltrated the health professions as well as the training institutions.
And as you're mentioning as well, it is something that's been punted in public health facilities, just the importance of breastfeeding as well. But sometimes the circumstances, whether it be work or other commitments that don't allow mothers to be able to do that. Are you finding that the message, though, is landing, is reaching where it needs to be reached for those who are able to and should be opting not for formula?
Absolutely, Marsa. All mothers want to do the best for their child, and they do know that breastfeeding is the best option. But as you so rightfully say, the environment is not enabling. So South Africa, for one, does not have paid maternity leave. In many of our employment opportunities do not cater for mothers when they go on maternity leave. When they do go on maternity leave, women need to navigate the processes to claim that money from the UIF, the Unemployment Insurance Fund. It's a long process. It's often not supported, and women give up. And then they return early back to work. So most companies give women at least 4 months of paid maternity leave through the UIF. But many women can't go without their salaries, and so they return back to work very early and then have to revert to formula. And as you know, the price of formula is astounding. And so the cost of formula is also prohibiting for women to actually adequately formula feed their child appropriately.
It sounds like a vicious cycle, Dr. Witten, because is that also why we can attribute the increase of 26% in malnutrition in children over the last 5 years as well? Are companies heeding the call as well and understanding how dire the situation is, that it's literally turned into a life and death situation?
Unfortunately, Marcia, like everything in South Africa, inequity is the underlying driver. So we know that the children that are most likely to die are living in the poorest of households. And that's why those provinces that you have mentioned where the deaths are happening, two of them are our rural provinces. Many mothers move from the rural area to the urban area to find work. We also know that Gauteng is a very concentrated area where people are coming in for work. So childcare is not always available to all mothers. And this is another reason where children are not adequately cared for. They are not with their primary caregiver. When a child is not with the primary caregiver, the risk of dying is higher, the risk of disease is higher. And we also know that for children, young children, particularly those under the age of 2, the reason why mothers also stop breastfeeding is because they're expecting the next child. And so family planning, contraceptive uptake is very low. And this is another reason that is fueling mothers who have too short the birth spacing. That second child that is on its way is compromising the health of the first child.
A little earlier, you also mentioned the kinds of food that we are feeding children as well, and just how it lacks in some nutritions as well. But of course, we can also attribute that to just the rising cost of living and the food basket just increasing as well. On average, what is actually missing from that plate, and what can be substituted for those proteins in a cheap way?
Yes, Masa, not only I'm going to speak a little bit about the protein, but we also need our families and our households to understand how important it is to include fruits and vegetables. And we find that these are the most costly commodities in the household and on the shelves is fresh fruits and vegetables. Children should be getting fresh fruits and vegetables as part of the diet. We call that dietary diversity. It means the number of different kinds of foods that you include in your child's diet gives your child a broader base for nutrients. Now, if you constantly are only feeding your child cereal, so we're having soft porridge in the morning, porridge in the afternoon, porridge for the evening, only with added maybe a sauce or maybe a gravy, that gives very limited micronutrients. Secondly, we know that the high quality proteins like meat and good quality meat, eggs, fish, chicken, these are the most expensive. And many of our poor households, although they call it meat, are relying on processed foods like Viennas, tinned and corned beef in those pre-packs, the offal that we have from the intestines or the heart or the livers that are cheaper options. Chicken feet are a cheaper option. So our households are not able to actually afford the high quality meat. So I want to say both the proteins, which is your meat and meat products, as well as fruits and vegetables need to be included in children's diets.
Dr. Witten, thank you so much for sharing your insights with us this evening and for your time.